Right, hello everyone. Thanks for attending today. My name's David Ashton and welcome to this webinar on occupational health and safety, brought to you by Business Station through the ASBAS Advisory Service. So let's make a start. I will email a copy of this presentation to participants after the event later on today, and a recording of this webinar is being made and will be available later as well. So let's make a start. My name's David Ashton. I'm Principal Consultant with Corporate Supremacy. I've been a business advisor with Business Station since 2014 on providing advice and guidance on a range of business, commercial, corporate service matters in relating to your business. So I've met with a lot of clients over that time, both on one-on-one advisory sessions, workshops and webinars. So I'll provide you with a lot of good information about how to set up a safety management system in your organisation, which is one of my professional experiences. So Business Station provides a range of business advice services, also business incubator support services. We can be involved with your business at all stages, so do take advantage of the services offered by Business Station. And through the ASBAS program, you can access those services at either no cost or low cost, depending on where you're at. So do take advantage of them. So what we're going to go through today is looking at occupational health and safety. There's a new international standard come out called 45,001 that outlines the management approach to safety in the workplaces, which is what I'm going to be focusing on today. I'm not going to be talking about the legislative side of safety. I'm talking about you as a business owner, you as a business manager, how you can implement practical policies and procedures to give effect to all the things that you need to do to maintain a safe and healthy workplace. So that's what we're going to go through today, is a discussion on the actual standard itself, and I'll give you some information throughout there on how you can develop and implement that system. And obviously, depending on the size of your business, will depend on, and what you do will depend on the extent to which you have to go through. So they're the things that we're going to be talking about today. So looking at the new standard, and all existing businesses that have their certification, and you can have these systems certified through a third-party certification body like SAI Global, for example, and there's obviously a fee for that, but it does allow you to market your business as being, meeting the requirements of an international system. So that's useful from a business development point of view, as well as from a management of staff point of view. So why should we have a workplace health and safety system? Well, for the obvious reasons, is it's going to help you provide a safe working environment for your employees and your contractors, prevent workplace injury and ill health, and improve safety management throughout your organisation. It's going to provide a framework for you to identify what your safety and health risks are in the workplace, and then put in place mechanisms to deal with those risks. It will set up a framework for you to comply with your various legislative requirements around workplace safety and health, and there is new legislation in place in WA in particular, but so it's very important to have a process to comply with safety. And as I said, I think it assists with business growth, because organisations are looking for your compliance with safety requirements and having good systems and procedures in place. And I know if you want to tender for government work, for example, and even private industry, you're going to get questions around the safety and health management systems and procedures that you have in place. I'm currently working with a plumbing company to set up their safety management system to get them ready, obviously to manage safety in the workplace, but to get them ready for a forthcoming tender that they're going to have to bid. And the requirements around the safety aspect of the business have increased significantly from when they last tendered. So if you're tendering for a local government tender, for example, you're definitely going to get a survey on your safety management approach. So having good documented policies and procedures around safety and health management will not only assist you mitigate the risks of an unsafe work environment, but also help you grow your business. So the complexity of an occupational health and safety management system, the extent to which you have to develop policies and procedures will depend on the size and complexity of the organisation. So your organisational context, your size, your location, culture, legal environment, the level of application, so to what extent are you applying this throughout the organisation, the nature of the business, so the industry types. Obviously a business involved in construction, for example, is going to have more rigorous components around their safety than what an office-based business is, for example, but the principles are still the same across the board. And then obviously the extent of your compliance obligations, and depending on the type of industry you're in, then that will determine the extent of your compliance. The approach that is taken to develop and manage safety and health in the workplace is what they call the PDCA, or Plan, Do, Check, Act cycle. So it's essentially the planning stage is determining and assessing the hazards, risks and opportunities within your workplace. The doing is implementing processes to mitigate those hazards and risks and realise those opportunities. The checking component is the monitoring and measurement. So once you've got your policies and procedures in place, you've implemented them throughout the organisation, you've done your training of your staff in the procedures, then you need to have a framework to monitor and measure the activities to make sure that you're following the requirements of your procedures, but at the same time you're also fulfilling your compliance obligations. And the final component is acting, so continuous improvement to achieve the planned outcome. So whatever you say in your management approach, you need to constantly be reviewing it and looking to improve to meet existing and future requirements. So that's sort of outlined in this diagram here. So the planning, the doing, the checking, the acting is all about putting in place the mechanisms to manage safety and health in the organisation and mitigate the problems arising. So looking at the ISO 45001 standard, it's sort of split into two parts here. You've got your introductory statements, so the scope, the references and the terms and definitions. But it's the requirements component, which is the part that you have to implement and demonstrate that you've got sound policies and procedures in place. And that's what we'll go through today. So context of the organisation, leadership and worker participation, planning, support, operation, performance, evaluation, improvement. So each of these requirements have a certain need for a policy or a procedure to give effect to them. So if we look at the requirements then, and these are in the order, so requirement number 4 is context of organisation. And this is basically assessing what your organisation is and what it does and where it fits into the economy. So understanding the internal and external factors that would help you determine that, because it's understanding the context in which your organisation operates that will help you set the framework for safety and health management in the organisation. So getting an understanding of the needs and expectations of your workers. They use the term worker in the standard, but applies to employees, contractors, like interested parties. They're your suppliers, your clients, your customers, all other parties external to you, that internally or externally, that you have to deal with on a day-to-day basis. So you need to determine the scope of the safety system. So, you know, you might be a large organisation and with multiple sites, but it'll only apply to one site in terms of your certification. Obviously, you need to develop safety across the board, but it's the extent to which you go. So implement, maintain and continually improve the management system. So you need to outline your framework for doing that. So if we look at the context of the organisation, we're looking at external factors that would determine that. So culture, social, political, legal, financial impact on the market that you have, the introduction of new competitors, knowledge on products, key drivers, external relationships, and any changes of those. So they're the sort of factors that are going to impact on how your organisation and your business operates. So those external factors, some that you have control over, others that you don't. So we don't have control over a COVID-19, for example. These things happen, but you need to put in place mechanisms to deal with those sort of things, and how you're going to manage that if they do arise. So internal issues, your governance regime, how you manage your organisation, policies, procedures, you know, your management of your resources, information management, so that's your record keeping and document control. Your relationship with your staff, you know, the time that they work, their work conditions, they're all factors in determining your safety and health management and any changes to those. So when we talk about organisational context, that sets the scene for you to then go on and develop your safety system. So getting an understanding of where you fit in to the market. So the next stage is leadership and worker participation. So now for those of you that are small businesses, again, the extent of all this depends on size, but you know, the minute you start bringing on staff and contractors and other consultants to work in your environment, then you have to give a commitment to safety management. So, you know, from your point of view as the business owner or the business manager, you need to demonstrate that leadership and commitment in acting on safety and health. You need to establish, implement and maintain an OHS policy. And, you know, these are often the policies you see on as you enter a business premises hung on the wall or on their website. So a one-page statement of intent, and I'll talk about that a bit later. You need to outline the roles, responsibilities and authorities assigned to particular personnel within your organisation, and they need to be communicated. So, you know, the safety and health, you know, you often see them in job description forms, the role of staff in maintaining a safe and healthy work environment. And then you need to put in place processes to consult and allow for consultation and participation of your employees. So things like toolbox meetings, seminars, the induction process for new employees. They're the mechanisms that you would promote safety and health and promote the policies and procedures you've got in place. You know, a staff notice board, putting, you know, notices and that up on the notice board. They're all mechanisms that you use to engage with your employees on workplace safety and health. So in terms of the policy, it's generally a one-page document backed up by a number of procedures. So the policy to comply, to be a policy that obviously has some value to the organisation, but is consistent with the requirements of the standard. You need to a policy is basically a statement of commitment or intent. We want to achieve this. This is why we want to achieve it, and this is how we're going to achieve it. And then you put in place your procedures to give effect to that. So you need to state a statement of commitment to providing a safe and healthy work in conditions. You need a statement saying that you're going to comply with your legal obligations and other compliance obligations. A statement committing you to eliminating hazards in the workplace, to reducing OHS risks. A statement that you're going to continually improve OHS in the workplace, and that you're also going to consult workers and their representatives and allow them to participate in not only the formulation of policies and procedures, but also the ongoing management and implementation of those policies and procedures, and any changes to those policies and procedures as you go along. So the policy must be documented. So as I said, it's usually a one-page statement stuck up on a wall somewhere, communicated, and it needs to be relevant and appropriate to your business. So it's quite easy to go and download, you know, a policy from someone else's business, but you need to make sure it's relevant to your business and relevant to the size of the business, the industry that you work in, the number of staff, and what you actually do. So, but you need to make sure that those dot points are covered off in the policy. So the next stage is, the next requirement is planning, and that is the process of you identifying your various risks and hazards in the workplace, and then putting in place measures to manage them. So hazard identification and the assessment of the risks, OHS risks, any other risks that are going to impact on the system, opportunities around OHS in terms of improvement, and any other opportunities. So it's about risk and opportunities, and the standard is very much risk-based. It's looking at your risks and risk mitigation. You need to also determine what your legal obligations are. So looking at the acts of Parliament that you need to comply with, and any other requirement, compliance obligations like contracts. I mean, you might have some contracts with suppliers or clients that require you to maintain, you know, a certain standard in relation to health and safety. So once you need to identify those and document them in a register. So having a risk register, having a legal compliance register, having a register of all your other compliance obligations. Once you've developed that risk register, then you can put in place, you can do that risk assessment around, the likelihood of it happening, the consequences of it happening, the causes of it, and then, the risk treatment around that. So how are you going to mitigate those OHS risks? So the plan is around developing various procedures around addressing the risks and opportunities, fulfilling your legal and other obligations, responding to any emergencies. So you need to have an emergency management plan, and you need to integrate safety into the business process. And I mean, I do a lot of work with businesses on management systems, generally quality, environment, safety, information security, business continuity and the like. And I also am a qualified auditor of these systems. And the thing that you don't want to get to is that it's all this management system is just this thing sitting over here that you've got to comply with. It's a compliance system. Oh, I've got to do this because I've got to comply with it, or I've got to fill out a form. You've got to think of it along the lines of, this is now the way we do business. It's not this thing over here that we comply with. This is what we do. Everything we do it like this. And why do we do this? Because it's going to, help deliver a safe and healthy work environment. It's going to make us efficient in our delivery of products and services. It's going to present a credible image to clients that we are an organisation that, takes safety and health seriously. It's also going to appeal to current and prospective employees, because people, want to go and work for organisations that, that they know that their safety is going to be looked after. And again, the business development point of view, in the sense that it's going to allow you to fulfil certain requirements around tenders and business grants and help you access that market through those processes. So as I said, local government, I'm dealing with a client at the moment that's going to have a big tender coming up, and one of the big issues in that tender is going to be their safety management. So we need to knock them into shape to get them to meet those requirements. So very much a business development exercise as well. So as part of the planning of your management system, you need to set objectives. So what is it you want to achieve? Some of these are quantitative and qualitative. So, you might want to, in terms of, you want to zero lost injury time, zero lost days work, that sort of measurement, or it could be measurements around the perception of the system, so using surveys and that type of thing. So you need to put in place those measures to ensure that you're meeting the requirements of the system. So another measure could be, full compliance with legislation. So you're not getting any, notifications from WorkSafe of breaches of safety, those types of things. So put in place your objectives of what you want to achieve, put in place measures to, or put in place the measurable components so you can be sure that you're achieving it. Make sure the objectives are applicable to the organisation. So again, that after the determining the context of the organisation will give you an idea as to what sort of objectives that you should put in place. You need to monitor them, you need to communicate them, and they need to be reviewed and updated regularly. So in a tender submission, you may very well get a question of your safety performance, and you need to outline all your safety statistics around lost days and lost time and incidences and all those sorts of things. So you need to keep records of how you're performing on your safety. So the support side is looking at the internal management of the system and all the resources and the like that you are going to put in place to communicate your system, to engage with workers in the development and implementation, and also the physical resources and financial resources that you're going to devote to it. So physical resources in terms of providing personal protective equipment, safety barriers, depending on the nature of industry, that sort of equipment, and financial resources in terms of a budget. You're going to need, larger organisations will need a safety committee, so you need resources and training around your personnel in that. So determine and provide the resources to implement the OHS. Determine the required worker competency in the implementation of that and the development. So, for example, if you're setting up a safety committee, then the staff on that committee need to attend a training, and likewise, if you're putting in place safety representatives, they need to attend training. And then there's the ongoing training and awareness of your workforce throughout of the ongoing management and implementation of the system. So workers need to be made aware of it. You need to communicate your system internally and externally. You're going to get questions from your suppliers. If you do have a major safety incident, then obviously there's some compliance and legal issues around that, but there's also reputational issues. There's contractual issues with your clients, contractual issues with your suppliers. All these things could be implemented, could be affected if you have a system, a safety incident, and you don't have proper management procedures and the like in place to deal with it. So make sure that once you've set the system up, that you adequately resource the implementation and ongoing management of it. So in terms of providing evidence of your implementation of the system, and particularly if you are a certified body where you're going to have to do regular internal audits and have annual surveillance audits by the external certifying body, they're going to audit your record keeping. So you need to maintain documented information of your policies, your procedures, your work instructions, develop some templates and forms to help in the implementation, because they're going to want to see evidence of implementation. So if you develop the tools to assist in implementing it, then that's also going to help with the record keeping and evidence of implementation. So, in terms of your document control and, proper identification, formatting and review and approval mechanisms. So, and you need to control your documented information. So all your record keeping and documents, say distribution, access, retrieval and use, storage and preservation, control of any changes and retention and disposal. And I do run another webinar and advisory sessions on information security management. I gave a webinar earlier today on that very topic, so look out for future webinars on that, but that'll help you manage your information, because in terms of by having good record keeping around this, it's going to help you with your monitoring and your measurement, your management review and fulfilling your compliance obligations, including any certification obligations if you have that. So the operational side is the actual doing component of the standard and the business. So you've documented your policies, your procedures, your work instructions, you've got various forms and templates. Then you need to implement those, manage them and control them in order to meet the requirements of your standard, eliminate the hazards, reduce those risks. The other area too here is control procurement of goods and services to ensure conformity with the OHS. So looking at your procurement practices in terms of making sure that you're purchasing the correct product. So if you are purchasing safety equipment, that it meets that equipment meets relevant Australian standards. So purchase from reputable safety equipment providers, and that safety in terms of delivery of services, in terms of contracts, making sure any consultants or contractors or suppliers that come onto your business premises are also made aware of your safety requirements, and that they comply with those. That's important. So incorporate that sort of information into any contracts or terms and conditions. If you're a bigger organisation that has a front counter where they've got to sign, the entry book to and receive a pass, you might want to put some safety signage around there that they're made aware of. Many organisations provide inductions and that. So again, it's all dependent on the size and scale of your business as to the extent to which you go, but be mindful that you are going to have need to have measures in place to deal with your suppliers and contractors. So again, ensure contractors and their workers comply with it. Control outsourced functions. So again, if you're outsourcing components, safety and health is going to be a factor of your contract. And respond to potential emergency situations. So you do need an emergency management plan as part of your safety management system. So identify the types of issues that could crop up. Many organisations now have to have a COVID-19 plan. So that's part of safety as well as safety and health, and a compliance obligation. So, some of the emergency management plans I've put in place for organisations have things around, a bomb threat, flooding, electrical storm, particularly when I was working in the northwest, cyclone management, even having an angry customer at the front counter. How are you going to deal with that? A medical situation. So identify the types of emergencies that are likely to rise and then put in place plans to deal with that. So, and in terms of your ongoing management and review and implementation of the system, it needs to be flexible enough to change to changing circumstances, whether it be legislative changes or changes in the workplace, you know, improved knowledge and information that you come across, changes in technology. These things are all going to impact, well, they're going to impact on your business operations generally, and make sure that you incorporate any changes into your safety management system, take action to mitigate any adverse effects of those, and, you know, communicate that to your workers and provide them with training on any changes, and, you know, communicate those changes to your interested parties, being your stakeholders and the like. So clients, customers and suppliers and other parties that you need to deal with. So that's the operational side. And you know, in terms of the operational aspect, in terms of policies and procedures, well, the types of documentation you're going to need is an OHS policy, a procedure manual which incorporates workplace procedures, safe work procedures. So, you know, procedures say around fitness for work, drug and alcohol control, you know, injury management. They're the types of procedures that you would see in a safety management. Hazard identification, risk management, identification, all those types of procedures. You need to have a procedure around record keeping and document control. So yeah, keeping good records of evidence of implementation, evidence that you have dealt with, you know, that you've corrected non-conforming activities, that you've improved the system, because they're the things that an auditor is going to look for when they come in and audit your system. So procurement and contract management procedures, emergency preparedness and response, which we talked about. You're going to need a process of internal audit or internal review. So someone needs to be charged with reviewing or acting as an auditor and reviewing the records and making sure that there is evidence of implementation, improvement, and corrective action. So if you use equipment that is used for measurement, then you need to have calibration of equipment procedures. So even things like fire extinguishers, your smoke alarms, they're all equipment that needs to be regularly calibrated and checked to make sure that they're in working order. So you need to identify all that sort of equipment and develop a procedure around making sure that they're maintained to the standard that they need to be maintained to. So what we call non-conformity, well, that's basically things going wrong, and things do happen, so incidences and the like. So if, you know, a non-conformity has been identified, you need to put in place plans to deal with that, looking at corrective action, so fixing up the problem, and then putting in place measures to make sure that that problem doesn't arise again. And then procedures around your management review. So how are you going to review the effectiveness of the safety management system, and include in there, you know, the management review, including there things like your safety committee, and the processes that you give effect to any changes that you want to make to the standard. So I've just received a question about getting a copy of the presentation. Yes, you will receive a copy of the presentation. I'll email that through you later today, and you'll also have access to the recording of this. So yes, you won't miss anything. So they're the documentation that you've got as well, that you need to put in place. And as I said, the extent of that documentation is dependent on the size of your business. So obviously a large business with 100 staff is going to have a much more rigorous documentation of safety management than a business with 2 or 3 employees. But either way, the minute you start employing people or employees, contractors or others, you're going to have to devote some effort to a safety management regime. So then Part 9 of the standard looks at performance evaluation. So how are you performing in the implementation of your system? I mean, are you still having lost time from injuries? Are you still, is there evidence of non-compliance? So you need to monitor the performance to make sure that, one, the system is effective for the business at that point in time and it's achieving its objectives. You need to measure the performance, so keeping your statistics around safety incidences and the like. You need to analyse that to see where things are going right and where things are going wrong, evaluate that, and then look at the extent to which you're meeting your compliance obligations. So there is a lot of data gathering, record keeping and analysis of that information to make sure that you are fulfilling the requirements of the system. And if you're fulfilling the requirements of the system, you're providing a safe and healthy workplace and you're meeting your compliance obligations, and hopefully you're satisfying prospective and current clients and helping you to grow your business. Sorry. So you need to, in order to determine that, evaluate your system, you need to conduct internal audits regularly. Take into account, past audits, look at, what's gone on in the past, but also plan for the future. Review the system in terms of its suitability, adequacy and effectiveness. So, as things change, your system needs to change and grow with it. Don't be a slave to old procedures. If your procedures need to change to reflect the change in circumstances in your workplace, then make those changes, but have in place a process to document why and how those changes were made and what was the end result of that. And your performance in safety needs to be communicated to your staff and interested parties. So as I said, if you're completing a tender submission, you might get a question there to outline your safety statistics over the last couple of years. So if you've got that data readily available, it's going to help you answer those tender questions. And the final stage of that is the improvement. So you've got to continually improve the system to meet current and future needs. So you need a process of continuous improvement. So, enhance performance, promote an OHS culture, promote worker participation, communicate the results and maintain documented evidence and improvement. So having in place a continuous improvement, and that involves, the people that are on the ground, might find that a particular procedure is a bit onerous or isn't working effectively. Have mechanisms in place to allow them to relay that advice and go through a process to make changes so that the systems and procedures are relevant to the needs. As I said, you don't want to be a slave to the procedure. A procedure is there to help guide staff to do their job, and you as a business owner need to have that in place to protect yourself as a business owner, but also to provide that guidance to your staff as to your expectations of how they're to behave in the workplace. So, report, investigate and take action to determine and manage incidences and non-conformities. So that's important. Your non-conformance procedures, how are you going to identify non-conformance and how you're going to put in place measures to correct it. So react to it, evaluate it, review existing risks, determine and implement corrective action, and review the effectiveness of the action undertaken and make changes if required, and then make sure that you document that process that you go through. So that's your continuous improvement. So what I've gone through in this presentation is basically I've given you a summary of a 2-day course in ISO 45001. And the policies, procedures and documentation that you need to implement in your organisation to the scale relevant to your organisation. And I think the other thing that we should be mindful of too in terms of occupational health and safety, or workplace health and safety as it's becoming called. I use OHS because that's the title of the standard, which is an international standard. But we focus a lot on the safety, but it's also about health, a healthy work environment. So what do we talk about in terms of health? And that's, it could be what measures do you put in place to maintain a healthy environment, whether it be physical health, mental health. So some examples of, health, a healthy work environment could be providing, some organisations provide a workplace, care scheme, or an opportunity for workers to access mental health support or psychological support, or like employee assistance program, that type of thing. Other measures could be, regular hearing checks if they're in a work environment that does have a lot of noise. It could be, posters in the kitchen about healthy eating or something like that. End of trip facilities, showers and bike racks for staff that want to walk to work or ride to work. They're the sort of things that could be considered as health, helping to maintain a healthy work environment. So when we talk about OHS, the large focus is on safety, but let's not forget the health side of it as well. So that's also an important consideration, and that's why it's called workplace health and safety. So it's health and safety, not just the safety component. So that's the end of my presentation. I'll just sum up then. I will hang around till 3 o'clock if anyone's got any questions. I will provide a copy of the presentation, and a copy of the recording will be available. But a successful occupational health and safety management system will have top management commitment. So that's you as the business owner or senior management, a commitment from all levels of the organisation to implement it. So that's what we mean by commitment, is that you're committed to developing the system, but you're also committed to implementing it and making sure that it works and delivers its objectives. There's adequate communication and consultation across all levels. You've got to set effective processes in place to identify hazards, risks and opportunities. There's sufficient resources, physical, financial and otherwise, to implement the system. It's fully integrated into your other business processes. So, it's not just this thing out to the side that we've got to comply with. It is actually the way we do business now. There is continuous monitoring and measurement of performance and continuous improvement, and also there's documented evidence of implementation. So the importance of good record keeping and document control. So, and I believe a successful OHSMS will lead to a safe and healthy workplace, fulfilment of compliance obligations, business growth, through the opportunity to win tenders, and that by having a good safety system and all the other factors that you've got to have to win a tender. But and reputational, managing your reputation, having a good reputation, attracting good staff, that type of thing will are other factors as well. So that's my presentation. Thank you for participating. This is the 4th one I've done today. I'm going to do another webinar session next month, but they're all interlinked. The first one I did this morning was introduction to tendering, so how to find and write tenders. Then I did business grants and assistance, and then two of the, in order to win grants and tenders, you need to demonstrate your organisational capacity, and the way you do that is through your business operations. One of the things is through your business operations, your management systems and procedures, because they're questions you're going to get asked about in those things. Obviously, you need to demonstrate good supply, customer service and delivery of products and that, but things like safety, information management, environmental management, quality management, business continuity. They're all important. You know, if you've got robust systems and procedures around those things, it's going to help you build your credibility as an organisation to win tenders and other work. So I do see a business development focus. So that's my contact details. If you'd like to have a further discussion about your own particular needs, I'm happy to do that. I am a qualified safety auditor and have developed numerous safety management systems for organisations, so I can help with that. I do so one-on-one advisory workshops and webinars, so happy to have a chat to you about your needs and arrange for an advisory session under the ASBAS program for that, which will be either low or no cost, and we'll go from there. And if you've got any other questions, and take advantage of other business station services, and that's the website where you can do that. So I've just got another question coming through. Maggie's just asked me a question about non-profit groups. So yes, I can help with non-profit. In fact, I've spent the last 6 months with a disability service provider helping them with their NDIS framework, and part of that was developing some procedures around safety and other quality management type procedures. So yes, can assist not-for-profits as well. So as I said, I'll stay on the line. If you've got any other questions, drop them in the chat box, and we'll go from there. And as I said, I'll send you a copy of the presentation and that a bit later on. Thank you for your participation, and good luck with your future business endeavours.